Hi, I'm David Rapaport, board certified plastic surgeon with more than 30 years experience, and I'm also the founder and medical director of Aethos, from where I'm speaking right now. Let's talk a bit just about incisions for double chin lipo, also known as submental lipo. Some people call it neck lipo, but it's not as much the neck as it is this space under the chin. So what I want to say is there's either going to be usually 3 incisions, sometimes 4. It all depends on whether we're going up with microsuction, micro lipo into your jowls. If you don't have a jowl issue, or we're deciding we're not messing with your jowls, we're just treating what's under your jawbone, this fat and this fat, then you're gonna have 3 incisions. One where each ear meets the head towards the backside, so you're really nobody's gonna see it, ever. And then the other one's going to be in the midline or right off the midline. I'm always going to look and see if you got an injury as a little kid, but we're talking a 2 millimeter thing. It'll look again like you had a mosquito bite. Now, let's say you're more in the older age group, or you just have a bigger jowl and we want to go not just this way, but we want to go north. And there I don't even use a machine. I use only my hand lipo and very fine instruments to do some lipo in there. Then instead of 1, 2, 3, you're going to have 2 incisions here. So you're going to have a total of 4, meaning there'll be incision under your jaw with which I can go up or I could go across. And one thing we do when you make incisions, they're the same way as when I use filler. A vein finder is very helpful. So I use that vein finder to make sure I don't have the bad luck of making my incision right over your facial vein as it goes into your neck and giving you a big ass bruise. So we try to avoid that. But the typical submental lipo, if we're not going up in the jowls, is just going to be 2 invisible and 1 mosquito bite under your chin. That's the whole deal. Thanks.